Welcome to Breakfast with Spaniels with Dr. Judy Morgan.
Morning, Kim. You are always right there.
Remember, you can purchase all of Dr. Morgan's products at her website at www.drjudymorgan.com. Now it's time to sit back, relax, and enjoy the show.
So I'm thinking Facebook is not sending out notifications or is sending them very, very, very slowly. Because our numbers are slow to go up. So, morning, everyone. Today's a really busy day for us. We are working as hard as possible to get ourselves moved into the house this weekend, which means I'm trying to pack in between other things. Yesterday we got to babysit all day, which means we got nothing done all day. Sarah is so much fun, but she's very, very mobile and into everything. So just lots of fun. But I really enjoyed my time with her. Yesterday was I'm not going to nap. You can't make me not going to do it. So, yeah, Mom and I ran around all day. And Sarah's favorite animal so far seems to be cats, and she can say kitty cat, and nobody else would know that that's what she's saying, but she says kitty cat, and she likes to chase them around, and ours have gotten very good at running and leaving the room when she is in the room. So, so most of you have seen that we adopted yet another barn kitty. His name is Tom. He's a big, orange, very skinny kitty. The rescue, it's a feral trap neuter release program. They estimated him at 15 years old. I'm not sure that he's that old. He does have a lot of tartar and gingivitis, little cloudiness in his eyeballs, but his biggest problem is he's very thin. And on a body condition score of 0 to 9, they gave him a 2, so he needs some groceries on his little bones. We started him out with some wet food because he has some dental issues that we're going to have to get solved. But, hi, Avetta. Thank you for your donation. They were nice enough to run a leukemia and feline AIDS test because we won't bring a cat into our barn without being tested first, and that's not something that they generally do as part of their program, but we kind of begged, and they were nice enough to do that ahead of time. So we do know that he is negative, at least for those viral diseases. And so of course when they come through rescue like that, the poor thing was neutered, vaccinated, treated with Revolution, and a second dewormer, I think Parental. But that's just the way they do the program, and that's fine since he's going to be an outdoor kitty. But my suspicion is that he probably is hyperthyroid. It's either that or he's got bad kidneys, but I did do an abdominal palpation. His kidneys didn't feel bad. I did not have a stethoscope with me, but his heart was racing. Now, was his heart racing because he was just scared to death meeting me for the first time and traveling in a carrier and all of that? Or was his heart racing because he has hyperthyroidism? So hyperthyroidism, in dogs, we normally see hypothyroidism, where the thyroid is underactive. In cats, we see hyperthyroidism, which is a tumor basically in the thyroid gland that makes it overproduce thyroid hormone. And so it really revs up the metabolism. A lot of times, these cats will eat 8 meals a day, 8 full meals a day, yet they keep losing weight. A lot of times they have vomiting and diarrhea. A lot of them will develop heart disease because their heart is racing at 250 to 300 beats a minute. They'll develop heart arrhythmias, and a lot of them also have kidney disease. So it's pretty easy to test them. Basically, we need a thyroid test to see what their levels are. Most labs that are used by the veterinary community, the normal thyroid level for a kitty is 1 to 4. And on some of these hyperthyroid kitties, we'll get 12s and 15s, and those are very high. So once Tom gets sort of settled in, I would love to test him and see where he is. And I'd like to get just general blood work and urine on him to see what his kidneys are doing as well. Another giveaway for him that I suspect he's got some heart issues is that he does open mouth breathing whenever he gets stressed. And cats don't normally pant like dogs do. So if you see a cat with open mouth breathing or panting, unless they're in an extremely stressful situation, even then they generally don't do it. That's a sign that you want to get that kitty looked at. So if Tom does come back as being hyperthyroid, we have basically 3 options, well, maybe 4, for treatment. So the normal treatment is a drug called methimazole. The problem is it is a twice-a-day treatment for life, and you do have to monitor lab work because it can suppress the bone marrow so that they will become anemic and not have enough white blood cells as well. So it basically shuts down all the blood cell production in the bone marrow, so that can be a problem. It also can unveil underlying kidney disease that you may or may not have known was there. So medicating a barn cat that is pretty shy twice a day could create challenges. The medication can be in a tablet, a liquid, or a transdermal gel, which would probably be the easiest, but is also the most expensive. The gel you can put inside the ears. That's the best place for kitty cats because that's one of the only hairless areas in kitty cats. So, rounding up this guy twice a day when he's pretty shy and hiding from us would be a challenge. The second thing that can be done is you can have the tumor surgically removed. That's not done that often, partly because a lot of times these cats are not stable enough as far as cardiac function and kidney function to have the surgery done. And sometimes after you remove the thyroid, depending on how much you have to remove, then you may have to give them thyroid replacement hormone. So are you any further ahead as far as medicating the cat? No, then you'd have to give thyroid replacement hormone twice a day. So we're still medicating the cat twice a day. So that's an issue. The third treatment option is radioactive iodine, where basically they go to a specialized veterinary center. Actually, one of my classmates, Rand Washstock, was the originator of RadioCat, which is the original radioactive iodine treatment center. He developed it. There are other, I want to call them knockoff groups that are not part of RadioCat that actually do this as well now. So that would be another option. It's rather expensive, but it's usually a one-time treatment. So they're given the radioactive iodine. It basically shuts down the overactive tumor. So that's a treatment that a lot of people are opting for just because it negates that long-term treatment plan. And then we do have some herbal treatments that work fairly well for these guys. Bugleweed has been known to be fairly effective at decreasing the uptake of the thyroid hormone that they're overproducing. It won't stop them from overproducing it, but it decreases the uptake. I did use that herbal treatment in my practice quite a few times. And I would say it was about 50-50 as far as success in treating these cats. So, and again, I would have to be medicating this cat with the herbs twice a day, every day, which is difficult, particularly when you have multiple kitties. Unless it's something that you can squirt directly into the kitty once or twice a day, putting something in food when you have multiple cats who are going to share the bowls is a problem. Um, so, lots of different options. So once Tom gets settled in and we see whether he's putting on weight and I can get a good physical exam on him, that will help determine what we need to do going forward. So for right now, we're just trying to feed the poor guy and also get him to like us. Our other the other 3 cats that we brought in, we were pretty sure one of them took off on the first day and hasn't come back, and there were 3 sisters. The other 2 still hide all the time. One of them has gotten brave enough that she will actually come out and eat in front of us, but won't let us get closer than a few feet. The second one, we'll see her if we're at the other end of the barn. We'll see her sneak out and grab food, but they're still really shy. So, taming feral cats, it takes a long time. They're pretty untrusting, and I can't blame them. They haven't had anything good happen in their lives. However, they now have a very nice, clean, warm place to live, and food twice a day, and they seem pretty happy, and they're catching mice, so we are happy. Okay, gotta get going. A million things to do today. Today is like crazy nuts. Not that every day isn't crazy nuts. I did just post a blog today. Please look it up on antibiotic use and misuse to go along with our guest interview that we did on Friday. I had written a blog on options to get around the overuse of antibiotics. So lots of suggestions in there if you have an animal that is prone to infections. Okay, gotta go. Have a wonderful day.